everyone, if you don't know me, hi, my name is Sarah. I am a first semester nursing student documenting my journey here on YouTube. And for today's video, it was actually inspired by a comment. So Destiny commented, "Hey girl, so excited for you. I was hoping that you could give me some advice. How did you know that nursing was for you? Was it an easy decision? And any tips for someone considering nursing would be so helpful. Thank you." So I wanted to make a video about that comment because I think it's actually like a really great question. The first part of this video is going to be discussing like my thought process was going into nursing and why I feel like nursing is for me. And then the second half of this video is going to be talking about personal attributes that you might have that could indicate that nursing is for you, and some tips. I don't want to say tips, but just like a little bit of advice with getting through nursing school. So this is so cool. So I guess we'll start from when I was very, very young. I had a death in the family. My youngest brother passed away. He was turning 4 at the time and I was turning 8, and I remember being a very little kid and kind of getting the sense that at the time he wasn't receiving the best care, and that started kind of like a drive to change things in some way, to like change, didn't know how, couldn't conceptualize it as an 8-year-old, but wanting to do better for other families so they didn't have to go through what my family went through with losing my brother. So that kind of started that at an early age. I remember just being like really, really mad. And I remember as like an 8-year-old being like, I want to slap everyone at that hospital. Like I was just mad. So that was kind of me. That kind of got the wheels turning. And then I went through, like, you know, most kids do. I wanted to be a fashion designer. I wanted to be a film producer. I wanted to be a lawyer. Somehow around 8th grade, I wanted to be a doctor. I wanted to figure out how to cure some disease like cancer. By my 9th grade year, I wanted to cure paralysis. Like I was just so like into curing things. And then 10th grade, I wanted to work for the United Nations because I was very into like humanitarian type things. And then by like 11th grade, I was like, no, I want to be a neurosurgeon. So then that got confirmed. With my 12th grade year, I took anatomy and physiology at the college level, and I was just like so gung-ho about becoming a neurosurgeon. Like I had a picture of me holding a sheep brain that I dissected in school, and I was just like so excited. I applied to colleges to be a biology major on the pre-med track. I was like so set on being a neurosurgeon. And then I had to come home from college for financial reasons, medical reasons. I was studying for the MCAT throughout me not being in school. I was like really, really serious about it. So I'm like, okay, I'm gonna figure out my MCAT while I'm not in school. I'm gonna teach myself orgo, teach myself biochem, just like do whatever I have to do. This way when I go to school, I can just focus on my classes. I can do like patient care hours. I can do like all, I was so set on going to medical school. And then around like 2019, my grandmother got sick, and I was pretty close with her. She had like a lot of hospitalizations, and she was like in and out of the hospital, and for some reason like we just knew that this hospitalization was different. She went in for jaundice, and I'm like, okay, like, you know, I just went to the hospital, and I was like, oh, she was getting admitted. I'm like, okay, I'll like stay with you, make sure you get into your room, whatever. I ended up just like constantly staying with her in the hospital, and like I was able to like, because I was like literally, I did not leave her side while she was in the hospital. Like I was able to see like her doctors, the nurses, like the aides, like I was able to see everyone and like get a better feel of like who does what role. And that's when I realized like, oh, maybe I want to do nursing instead, because I saw the doctor like literally once once a day during rounds, and like I like loved her nurses. So I was like, oh, maybe I want to do that. And it was funny because I was staying in her room, and like I think it was the PA, he asked me if I was a nurse, and I was only like 20, 21, and I was like, no. Because I guess it was just like the way that I was like talking, because I was like semi like quasi studying medicine because I wasn't really in college yet, but I was just so like fascinated. I would just look at stuff all the time. I just had like a medical type vocabulary, and so I was like talking about it, and it was funny that he thought I was a nurse. I was kind of like flattered by that. I was like, wow, like I'm just a regular person. But yeah, so then after she passed away, after my grandma passed away, that was September 2019, I'm like, okay, I'm pretty sure nursing is for me, because while I do have an interest in medicine and I do have an interest in like how the body works, and I was like so super excited to learn like all that stuff, the difference between medicine and nursing was two things. One was a lifestyle I'd be able to lead. I wouldn't really have to deal with being on call. I wouldn't have to worry about like being like the tip-top leader of the healthcare team. I don't want to say tip-top as if anyone's like better than anyone else, but just like I know myself, and like that would just scare the absolute crap out of me, kind of having to be like the person making all the decisions. Like that scares me. I can make decisions, like I do have experience as a manager, but that scares me. And I'm like, I know that if I really wanted to, I could do that, but just the level of stress is probably just too much for me personally to handle. And so yeah, it was the lifestyle that I'd be able to lead as a nurse. Like I'd be able to like work 312s, 5/8s, 410s, you know, whatever. I wouldn't have to work like crazy work weeks as a student, being a resident. Like that's insane. I would not want to do that. The money didn't really matter to me, because if at the end of the day, if I'm not happy doing my job, like it doesn't matter. So like the money thing with like, obviously like a neurosurgeon is going to make more than a nurse, but like I don't really care about that. So that, and then the education was like a huge thing. At the time of deciding I wanted to go back to school, I was like 22, right? I started my channel like 2 years ago. At the time of me going back to school, I'm like, okay, listen, I need to figure out a way to graduate like ASAP. Hey, also I wanted to add something. The amount of student debt, the amount of student debt also really drove me to nursing, because my community college tuition was $12,000 like total, like $6,000 a year. And I get my bachelor's for free, so I'm paying $12,000 for a degree, versus like having literally hundreds of thousands of dollars in student loan debt. That was another one. That was a big one I forgot to say, but I just wanted to mention that. So that was nursing. I was considering like physician's assistant. I was like, I don't really think I would have been happy in that role either. But something about nursing that I absolutely loved is the flexibility. I could go into nursing school, be an RN with a bachelor's degree, and then if I wanted to change my role, I could just master's degree for a nurse practitioner. It's just so easy. It's not easy, but like it's a lot more flexible than medicine ever could be. So that's something that just really gave me peace of mind as I was going into nursing, knowing that I could switch my role within the same field. You know, like if I wanted to do bedside nursing, right? But like say I really want to be in peds, say like I get sick of peds, I can go to med surg, I can go into cardio, I can go into ICU, I mean tele, I can go into ICU, I can go into med surg, I can go into neuro ICU, I can go into trauma, I can go into like ER, like I could do so many things just in bedside nursing. And then like I didn't have to do that. I could be a flight nurse, I could be a school nurse, I could work at a correctional facility, like I could work in a nursing home, like I can do so many things like crazy. People open like med spas and do like aesthetic nursing. Like I was shook. I was absolutely shook by the amount of things you could do as a nurse. And then if I really didn't want to do that, I could be a nurse practitioner. I could see myself being a nurse educator, because teaching was another career field that I was like contemplating as when I was like a senior in high school, choosing my college major. I would have done like middle school education, which is why I kind of want to be a peds nurse, because I just like working with kids. But yeah, so anyways, that's probably like why I went into nursing. Long story short, I really like medicine, didn't want to be in school for 10 years and like working with people. So nursing. My personality attributes that I have that I think would make me a good nurse. I am very caring. I'm very kind. I'm very like warm and outgoing. Like people tell me that I have like a very like friendly, bubbly, happy, positive vibe about me, which I feel like is very helpful as a nurse, because when I'm interacting with patients, like I obviously appropriate for the situation, right? Like if someone just got diagnosed with like a terminal illness, I'm not gonna be like, hey, how's it going? You know, but like, you know what I mean? But like most of the time people like to see other people that are happy, and I just am naturally like that. So, you know, that's why I feel like I would make like a great nurse. I have been told, interestingly, by some of my classmates that I'm like too smart to be in nursing school, but I feel like that's such BS. And if you're watching this and you're the person that told me this, hang on, hear me out. Because nurses are smart people. Like, nurses are so smart. You have to be smart to be a nurse. You cannot be a stupid nurse. I feel like stupid nurses don't exist. And if they do, then they probably got their license taken away from them. Because they make really careless decisions. Nurses are very, very smart. So I just wanted to say that. I'm gonna leave that there. Nursing is a very interesting thing. I'm gonna make a little list of, but what I'm describing, if nursing is for you versus not for you, is not an exhaustive list. And if I say something that you resonate with, it doesn't necessarily mean that it's like definitely for you or definitely not for you. This is kind of just like advice if you're trying to feel out nursing, if you're trying to figure out if it's for you. Just take my advice with a grain of salt, because I don't know you, so I can't tell you, you know? This is just like in general. So nursing is probably for you if, actually I'm gonna divide this into two separate things. Nursing and nursing school, because nursing school is no joke. I'm just gonna talk about nursing first. So nursing is probably for you if you like working with people, if you are able to resolve conflicts well, if you are able to, if you're like a good communicator, if you are a hard worker, let's see, time management, you probably need to be someone who manages their time well, but that can be learned over time. But in general, if you can use time management in like examples of how you live your life now. So like if you had a deadline, what are you doing to reach that goal of making the deadline? Are you waiting until the last minute to do something? If you have a lot of steps or activities to do in a short amount of time, how do you prioritize your tasks? Like things like that. If you're good at prioritizing tasks and time managing, that's a good sign. Obviously there is like a level of compassion and caring that you need to have to be a good nurse. Example, you know, you can be a nurse who's very focused on like tasks and just getting stuff done, or you can be a nurse who is also generally focused on tasks and how the patient is feeling. And like what I mean by that is you have, you know, a nurse who works in the ICU who is just doing everything they do for the patient. They're in, they're out, they're boom, done. And you have another nurse who takes the time to flip the pillow to the cool side for the patient who can't do it for themselves. And they're still doing their tasks. And I'm not saying the nurse who gets everything done is very task oriented is a bad nurse. I'm just saying, like, if you're able to be like empathetic and feel like, okay, if I was laying in bed and I was like super hot and I, you know, didn't even think to turn the pillow over, like having someone do that for me would be like really nice. Or, you know, making sure that the person is comfortable before you leave the room instead of just doing what you need to do and get out, you know? Like if the person wants ice water, like, you know, getting it for them. If the person, you know, has a hard time cutting up their food, like cutting up their food for them, like things like that, instead of just giving them the tray and leaving, you know? Also, let's see, you have to be very patient. I feel like good nurses are patient for, you know, behavior that isn't necessarily perfect, because people are going to be cranky when they're not feeling well. And while it is never okay for that person to verbally abuse, physical assault nurses, they're gonna be like snippy and like annoying. But we have to be patient and not take it personally and not react to them. So if you're someone who is able to kind of de-escalate a situation very well, that would be helpful. There are probably other things, I can't think of them right now, but like I said, it's not like an exhaustive list. And so nursing may not be for you if, and I want to say this lightly because I don't want to discourage anyone, and also, like I said before, take this with a grain of salt, because just if you fall into like one or two or multiple, doesn't necessarily mean that it's not for you. I'm just giving pointers, I guess, guidance. If you have a very short temper and you find yourself raising your voice, being aggressive, screaming, cursing, being otherwise like unprofessional with your coworkers, probably not a great situation for you, because you may find yourself in situations where you're stressed out and you're going to be more likely to have outbursts if you're stressed. So keep that in mind. Also with patients, if you work in retail, this is a good indicator. If you find yourself needing to kind of like clap back at people, probably probably not the best environment for you. If you have a hard time resolving conflict, and this could be either you're super passive and don't advocate for yourself when you need to, because this can translate to like, how would you advocate for a patient if you really needed to? If you had a doctor who was not nice and you felt like your patient's safety was at risk, like, could you advocate for your patient? If the idea of being on your feet for long hours bothers you, if you have a hard time regulating your emotions, if you find yourself, you know, really overwhelmed easily and you have a hard time regulating that, or anxious easily and you have a hard time regulating, I'm definitely not saying that people who have anxiety can't be nurses, because I have anxiety, but just in the moment, being able to act in like a calm way, because your patients need that from you. What else? If you kind of view yourself as superior for being a nurse in relation to unlicensed personnel like CNAs, or even other nurses like LPNs or MAs or environmental services, like if you are someone that views yourself as better, not really going to be great at facilitating teamwork. If you're the type, and if I feel like this takes a lot of self-reflection to know this. So if you're the type of person in high school to be like, okay, I'm going to clean up after myself at the lunch table because that's what people do, or I'm going to be a little bit careless, who cares if I leave my lunch there because the custodial staff will clean it up for me, nursing may not be for you. Because like, yes, people have their roles, and at the same time, it's your responsibility to like delegate things appropriately. Like if it is in your job description, that is probably something you may still have to do. Like as a person, you have to clean up after yourself. You can't just be like, oh, the janitor will do it. You can't just be like, oh, patient in room 201, you know, did whatever, I'll just have the CNA do it, even if I'm not busy. Like, you can't, you know what I mean? So that. Also, if you find yourself being impatient, just for your own sake, you may not want to put yourself through that. Nursing may not be for you. And then, like, I'm going to say this one last, but if you're doing it, if you see the salary and you're like, yeah, that's, and you just don't even think about anything else, you're just like, I'm doing it for the salary. If you're able to get through nursing school, that's fine. I'm going to segue this into nursing school. If you're going to nursing just for the money, nursing school will weed you out. You will not survive nursing school if you're doing it just for the money, and only for the money. I can't see anyone wanting to put themselves through nursing school just for the money. I can't. And if you do, I guess, congratulations, I guess. I don't know. Nursing school is absolutely insane. It's crazy, 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 crazy. In the best way, and also kind of in the worst way sometimes. nursing school is probably for you if you like school, if you enjoy problem solving and critical thinking, if you have a very clear understanding of how to study for nursing school. And like what I mean by this is, it's not like, I don't know if it's like any other class you could have taken in the past. Maybe anatomy could be like this, maybe, but it's not, the questions aren't like, say you learn about, oh my gosh, this is gonna be such a weird example, but say you learn about orthopnea, right? Which you're taught in school. Orthopnea is trouble breathing when lying down in a supine position, like perfectly flat. So you learn that, right? You don't really learn anything else about orthopnea other than a way to relieve orthopnea is to like just raise the head of the bed. You know, you raise the person up, have them sit up, basically. That is all you would learn about orthopnea in nursing school. And then on your test, a question could be, what is a question that you would ask to assess for orthopnea? And the answer choices would be, do you have a productive cough? Is your sputum rust colored? How many pillows do you use sleeping at night? And do you have difficulty breathing? And if you didn't know what orthopnea was to begin with, you'd be screwed. But if you knew what orthopnea was and couldn't critical think your way to the answer, you could also get the question wrong. So like nursing school is a lot of that. It's a lot of critical thinking. Like they will teach you the definitions of things, they will teach you the procedures, and then you have to like critical think. And so while learning things on flashcards and just strict memorization kind of helps in a sense, it doesn't guarantee you an A, because you can learn the definitions all you want, but if you can't critical think to the answer, you might not pass your test. So it's that. Also, you will have a higher chance of getting through nursing school if you're resilient and don't give up easily. I refuse to give up. I refuse. Like I refuse. I am the type of person that almost to a fault will put themselves through hell just to do something that they set their mind to. Whether this means, you know, pulling an all-nighter to get my work done for that day, or just being completely miserable studying about a topic that I don't want to do, but I just do it because I just want that good grade. Like I guess I just get so hyper fixated sometimes on grades that it almost is to my benefit that I just like refuse to do anything less than what I need to do. But it comes at a cost, like the stress of and the pressure that I put on myself. But nursing school may also be for you if you are able to like have the mentality of helping other people while they're studying or with studying, because it makes you better too. But just like volunteering yourself for things and stepping out of your comfort zone, like in clinical, like if you're the type of person to kind of like take initiative and like do things, that could be a good sign that nursing school is for you. If you find yourself while you're in school being like actively engaged in class and like paying attention, not really like surfing TJ Maxx or like checking your emails or like doing anything else but listening to the professor, nursing school could be for you. And if you find yourself like even while not in nursing school, like taking school seriously, there's a good chance that nursing school is for you. Nursing school may not be for you if you give up easily, just point blank period. If you're the type of person who is used to just being good at everything and not having to try, you may emotionally struggle in nursing school because everyone has to try nursing school. I don't really know of anyone in my cohort right now that isn't like putting 110% in right now. And if they're not, they're going to fail the exam. Like, that's just it. Nursing school, if you're looking for it to not be as hard, I would recommend doing like a CNA program first and then building on that, becoming an LPN, and then doing an LPN to RN bridge program. To me, that seems like, at least from the outside of someone who is going basically from nothing to RN, probably breaking it down in steps would be easier, so you slowly start thinking like a nurse as you learn things. But just going from nothing to an RN program is, your brain like grows so much. So also, I also want to say this again, preface this, I'm saying this lightly, take this with a grain of salt. If you really struggled in your anatomy and physiology class, particularly that class, nursing may not be for you. And I don't want to say that if you didn't do well in your A&P class, like you're going to fail out of nursing school. Like, I don't want it to come off like that. I'm just saying you need a solid understanding of anatomy and physiology to do well in nursing school. So if you don't have that, you're going to have to kind of like relearn it as you go. It's just that nursing school can be so much work already that trying to learn that on top of nursing school could be too much. It may not be. You may be able to do it, and that's great. But for some people, I'm noticing just a trend of like other people who are online, if they fail A&P the first time or the second time and then they go to nursing school, they may not be able to, things may not click at first. Like, for example, like right now I'm doing oxygenation and perfusion. If you can't understand that, like, I'm just using this as an example, that gas exchange happens at the alveoli in the lungs, and how the actual exchange works with like diffusion at the like the capillary walls, and like if the question then on a test would be asking for like manifestations of, I'm just using this as an example of like impaired gas exchange, you wouldn't be able to like, you know what I mean? So if you were like, if you just understood the nursing side without understanding the anatomy side, like you're kind of just memorizing things instead of like understanding things. And then lack of understanding could kind of make things harder when you're trying to critical think your way to the answer on a test. So yeah, also nursing school may not be for you if you make excuses. Nursing school is a lot of work, and you may have to work a lot harder than you would think to do well in nursing school. If you're telling yourself, oh, well, I'm just a bad test taker, how do you fix it? You know, like you got to fix it, because you can't just go through nursing school being like, oh, well, I'm a bad test taker, and just fail everything and then fail out, because then you're not going to be in nursing school anymore. You're never going to get to your goal. It would be more beneficial to kind of be like, okay, this is my weaknesses. I'm going to try to fix my weaknesses. If my weaknesses are, you know, self-doubt, procrastination, how am I going to not procrastinate? So I set myself up to do better. And kind of like resisting the urge to like stay stuck. That's like, I think one of the number one things, because you're going to be faced with obstacles in nursing school. The question is just how you get through it. So if that's, I'm a really poor test taker. Okay, so do you need extra practice questions? Do you need a tutor? Do you need to go to office hours? Do you need extra study time? Do you need accommodations on a test? Like, you know what I mean? Instead of just sitting there being like, oh, well, I'm just bad at taking tests. So yeah, so that's kind of like my perspective, at least, about what might make it easier versus harder for you to go into nursing. It's definitely lots to think about.
In typical fashion, I forgot to film an outro. Oops. I hope this video didn't come off as too negative. I'm just trying to give you like a realistic sense to really grapple with the decision of going into nursing, because it is a very big decision. I think, though, if it works for you, it's going to pay off and it's going to be amazing. But I wish that I had someone who was kind of like real with me and didn't like blow smoke up my butt. Like, oh, you'll be great. You'll love it. It'll be perfect 100% of the time. You will have no obstacles. Everything will be easy. Like, no, like I really wish that I had someone who was like, things are going to get tough. You're going to get through it. You know, you just need to figure out within yourself, like, how. So basically, that's like the gist of this video, was just basically like, yes, nursing school is hard. Is it impossible? No, because if it was impossible, there'd be no nurses. But like, really contemplating if nursing school is for you, because I don't know about you, I would hate the idea of like putting my energy into something that wasn't for me. And then also having peace of mind that something may be for me when I go into it. So this was just like a general like advice video. I hope you liked it. Hopefully it wasn't too negative. I was editing this and I was like, wow, I sound so negative. So hopefully it wasn't. Hopefully you're not discouraged about going to nursing and you just have a better, not better, but more realistic view of what nursing and nursing school might be like. That was kind of my intention to make this video. So if you made it this far in the video, thank you so much for watching. If you want to see my face again, consider subscribing, and I will see you next time. Bye.